Hello, my name is Liz Abadiotakis. I am a pediatric occupational therapist and a parent of 2 young children. I am here to speak with you today about ways to empower your children to become more independent. I will do this by educating you on 4 key steps that occupational therapists use to help children improve performance. So let's get started. I want to explain what occupational therapy is to those of you who may not be familiar. OT, as it is referred to, is a profession that is grounded in science and supported by evidence-based research. OTs are skilled in analyzing daily occupations to help people become more independent. The word occupation for children can include play, self-care tasks like dressing and brushing their teeth, learning and socializing. Your occupations as a parent can include caretaking for children, self-care, taking care of the home, work, and leisure. OT's focus is on addressing occupational performance. That means that when there's a problem with an occupation as simple as putting on a shoe or as complex as getting 2 kids ready and out the door in the morning, an occupational therapist can help. For the purpose of this video, we will be using the examples related to getting children ready in the morning for school. Step 1 is to identify the challenge. In order to truly identify what the challenge is, we need to look at 3 components: the person, the task, and the environment. Keep the next 3 video clips in mind as we go through these components. First, the person. When we consider our child, we need to think about what we can expect from them, considering their strengths, and what we should not expect from them, considering the areas that they may need to further develop. Check with your pediatrician regarding what you can expect from your child at their age of development. For example, a child may have the physical ability to get themselves dressed, eat their breakfast, and brush their teeth. However, they may not have the time management skills to be able to do these things in a timely manner. Next is the task. When we look at a task, we must break down all of the steps to see which part is potentially causing a challenge for our child. For example, a child may be able to put on their jacket and shoes independently, but may have a hard time with the zipper on a certain jacket. Or they may have a hard time untying knots in their sneakers in order to get them on and then retied. Understanding each step of the task helps us to decide which part is a potential challenge so that we can help our child. Next is the environment. What we need to consider when looking at the environment is where our child is completing the task. When getting ready in the morning, is it loud or is it quiet? Does it feel calm or does it feel rushed? And when thinking about the environment, we need to think if what is happening around our child, is that helping them or is it not? So when a child is getting ready in the morning and the TV is on, is that distracting to your child or is that helpful to your child? Let's think about the person, the task, and the environment as we review these clips again. The questions we need to ask when identifying the challenge is in these scenarios that we've just seen is, can my child brush their teeth without any physical help? Can my child stay on task to brush their teeth with another sibling in the room? Is my child timelier when I am present in the room? Beginning to ask these questions related to the person, the task, and the environment will help you decide the true barrier to your child becoming more independent. Step 2 is thinking about motivation. We need to think about motivation in 2 ways. First, we must understand what motives our child has. For example, a child may have the physical ability to get shoes on without laces, but they may have the social desire to wear tying shoes like their classmates. Second, we must understand what motives we have as parents. For example, as parents, our motivation may differ in the morning, as we are motivated to be on time so that we're not late for work and the children are not late for school. Our desire may be to have the child put on the easiest pair of shoes so that we have the time to feed the dog and hopefully feed ourselves too. Understanding our wants and needs, as well as understanding our child's wants and needs during a challenging task, can help us find a cooperative solution that is motivating to our child and to us. Step 3 is skill building. Now we have identified the challenge and we understand our child's abilities and their motivation. The next step is figuring out how to allow our child to be independent while helping them. It at first sounds like a conflict and that we want, for example, for our child to get dressed in the morning on their own, but we must help them in order to get out of the house on time. Finding the balance of how much help to give and when to give help is important when working through a challenge. When we are skill building, we need to do 3 things. First, we need to schedule time. Skill building takes time and motivation on the part of our child and on our part as parents. It is important to schedule time for skill building. If our identified challenge is having our child wear tied shoes in the morning, we need to either A, wake up extra early to allow time to work on shoe tying in the morning, or B, help them tie their shoes in the morning during the week, but maybe on the weekend, work on having them tie their shoes on their own when there's no time limit. The second thing, we need to find frustration. So how much help we give is unique to each child. We need to observe at what point our child becomes frustrated with completing a task. We want to begin helping just prior to them getting overly frustrated. We want to provide them with help before they want to give up and while they are still interested in finishing the task. Your child's frustration point may differ day to day, depending on sleep, food intake, and overall health. When you're looking for frustration, try to identify your child's tone of voice or facial expression before they reach the point of frustration. These are signs that you will be able to look for whether they have a high level of frustration tolerance or a low level on any given day. The third thing we need to do is we need to change the challenge. In order to help our children be most independent, we need to support them in the same 3 components that we discussed in step 1, the person, the task, and the environment. There are many ways that we can do this. If the challenge is a concern because our child is not developmentally ready to complete that job or that occupation by themselves, then we can continue to provide physical assistance or verbal reminders until they have further developed those skills. If the challenge occurs because the task is difficult, then we can break the task into smaller chunks. For example, having our child pack their backpack, pack their lunch, or pick out their clothing the night before helps make less steps for the morning. We can also try to create shortcuts for challenging tasks, such as using the child's easy-to-get-on clothing or preferred clothing during the week, or using a pump toothpaste dispenser instead of a screw cap to reduce a step and to increase speed. If the challenge occurs because the environment is not working, then we can allow more time in the morning, or we can eliminate distractions in the environment. We can, of course, also consider adding motivators by using items that are your child's favorite color or that have their favorite cartoon character on them, or even by using a challenge reward. A challenge reward is something that a child can work towards or earn once they have mastered a challenge, with your support, of course. For example, if your child masters shoe tying or works towards getting themselves ready in the morning on their own, they can earn a reward such as a dinner of their choice, a movie night, or even an extra hour of technology time. When working towards a reward, be sure that the reward is something that is not available until after the challenge is mastered. Step 4, reflection. The final step in this process is reflecting on what is going on during the challenge. Helping our child work through a challenge is an ongoing process throughout development. If your child continues to have difficulty with a particular challenge, it may be helpful to work through the steps outlined in this video with a friend or family member. If you do feel that your child has challenges that are more difficult to work through, please discuss these concerns with your child's pediatrician to see if a referral to an occupational therapist or another healthcare professional would be appropriate. To learn more about occupational therapy, please visit the American Occupational Therapy Association website at www.aota.org. Thank you for watching, and please be sure to complete the post-video survey.